Hi! Today, we're talking about something that could actually save your life. I'm going to tell you about 3 cancer symptoms that most people mistake for a common cold. It sounds crazy, but because of this, a lot of people lose precious time and only see a doctor when it's too late. Stick with me till the end. I'll share one symptom almost nobody talks about, and it's more common than you think. After this, you'll definitely pay closer attention to your body and the signals it's sending. Symptom number 1: persistent cough and chest pain. The first symptom people usually write off as a cold is a long-lasting cough that just won't go away. We've all been there. You wake up with a scratchy throat, start coughing, and think it'll pass. But what if it doesn't go away for weeks? Take Ivan, 45, for example. He thought he just caught a cold on an autumn walk. He took some cough syrup, but it only got worse. A month later, he felt chest discomfort and sometimes got a bit short of breath. He only went to the doctor when he noticed blood in his phlegm. The diagnosis? Early-stage lung cancer. Why does cancer show up like this? Tumors in the lungs irritate the airways, causing inflammation and a constant urge to cough. Early on, it can feel just like a regular cold. Your body is sending a signal, but your brain thinks it's stress, a cold, or allergies. Here's how to tell the difference. Regular colds usually go away in 5 to 10 days. Bronchitis can last up to 2 weeks and often comes with mucus. Lung cancer coughs last more than 3 weeks, may get worse at night or with activity, and sometimes bring up blood or dark phlegm. And here's the danger. People keep trying home remedies, antibiotics, or syrups. That wastes time, and the cancer keeps growing unnoticed. Chest pain is another warning. It might feel like heaviness, a stabbing pain, or discomfort when you breathe. Many think, I just overworked, my muscles are tired. But if it comes with a cough, don't ignore it. Myth busted. Lung cancer isn't just for smokers. Smoking increases risk, sure, but non-smokers can get it too. Pollution, genetics, and chronic inflammation are all risks. Tip: if a cough doesn't go away after cold or bronchitis treatment, get a chest X-ray or CT scan. It can catch problems early when treatment works best. Quick hack: keep a symptom diary. Note when the cough starts, if it gets worse at night, or if there's chest pain or blood. It helps the doctor figure out what's going on. Fact: early lung cancer might not cause fever or extreme tiredness. You could feel almost normal, except for that stubborn cough. That's why paying attention to small changes is so important. So, first symptom: long-lasting cough, chest pain, sometimes blood and phlegm. Seems harmless at first, but it can hide serious danger. Symptom number 2: unusual fatigue and weakness. The second symptom people usually blame on stress or lack of sleep is extreme fatigue. We all get tired after work or school, but what if the tiredness never goes away, even after rest? Maria, 38, worked in an office and thought her fatigue was just overwork. She constantly yawned, struggled to focus, had headaches, and lost her appetite. Tests revealed early-stage stomach cancer, subtle at first, but real. Why does cancer make you tired? The tumor steals your body's resources. Your immune system is fighting abnormal cells, and your body spends energy on inflammation. You feel drained for no obvious reason. Signs it's more than regular tiredness? Normal fatigue disappears after sleep or a weekend. Dangerous fatigue grows worse over time and sticks around, even after rest. It may come with weight loss, pale skin, and low appetite. Think about it. Have you ever woken up after a full night's sleep feeling like you didn't rest at all? That's your body sending a signal. Cancer often doesn't hurt early on. Pain usually comes later. Fatigue and weakness, though, are easy to miss. Tip: if you notice unusual fatigue with weight loss, headaches, or low appetite, get blood tests and see a doctor. This could be the first sign of cancer. Hack: keep an energy diary. Note when you feel drained, what you did the day before, and how you slept. It helps your doctor see patterns. Research shows over 40% of cancer patients noticed chronic fatigue long before diagnosis, often blaming stress or age. Fatigue can hide many cancers, from stomach to blood. So, second symptom, extreme fatigue and weakness that doesn't improve with rest, sometimes with weight loss, low appetite, or pale skin. It might look normal, but is actually a serious warning. Symptom number 3, unusual skin and mucus changes. The third symptom people ignore, thinking it's just fatigue or allergies, is unusual changes in skin or mucous membranes. A small spot, rash, or paleness might not seem like a big deal, but sometimes these tiny changes are early cancer signs. Oleg, 52, noticed his skin looked pale with a yellow tint, and small cracks appeared on his lips. He thought it was vitamins or tiredness. Weeks later, he had unexplained bruises and weakness. Tests showed early-stage leukemia. Why does cancer show up in skin and mucus? Your body reacts to changes in blood, nutrient shortages, and toxins from the tumor. This can cause spots, ulcers, gum bleeding, or yellow skin. Watch for pale or yellow skin without reason, bruises or tiny bleeds without injury, unusual moles or spots that change, changes in mucus, cracks, bleeding, white patches. Ever noticed small spots that don't go away for a week or more? That's a signal. Many ignore these thinking it's allergies or tiredness. But watching skin and mucus can catch disease early. Myth: skin cancer is only melanoma and always black. In reality, tumors can show as white, red, yellow spots, bleeding, or peeling. Tip: see a doctor for any unusual changes. Even small symptoms can reveal early cancer. Hack: take photos of your skin every few days to track changes. It helps your doctor spot patterns. Fact: about 30% of patients with internal cancers first noticed symptoms through skin or mucus changes, often blaming fatigue or diet. Skin changes might come with shaking, weakness, sweating, or low appetite. Together, they give a full picture of your health. So, third symptom, unusual changes in skin or mucus, pale or yellow skin, bruises, cracks on lips or gums, new spots. It might seem minor, but it can be an early cancer signal. So here are 3 symptoms often mistaken for a cold or fatigue. 1. Persistent cough or chest discomfort that won't go away, sometimes with blood and phlegm. 2. Extreme fatigue and weakness that doesn't improve with rest. 3. Changes in skin or mucus, spots, bruises, pale or yellow skin, cracks. Pay attention to your body. Don't ignore these signs. Early detection can literally save your life.